Welcome back to another episode of Ingrid's World. This show is departing from the usual format due to the seriousness of the topic. On this episode of Ingrid's World is dedicated to Liberia facing the Ebola crisis. We will learn how the virus originated, the impact of Ebola on the Liberian people. We will discuss and conclude the show discussing how Liberia is responding to Ebola and what has been done thus far by the global community and how we can help. So first of all, I'd like to thank both of you being here. Vickie Ward, thank you so much for being here, and Gabriel Williams.
Thank you.
Really happy to have you both here to talk about the seriousness of this issue of Ebola. Well, let's first of all start with the beautiful country of Liberia, and let's talk about Liberia in its sense.
Yes, first let me say on behalf of the Ambassador, His Excellency Jeremiah Solonte, and the government and people of Liberia, we're very delighted to be on this program and the effort it has provided for us to be able to create better awareness about what's happening. Liberia is a very unique country in Africa because of its history to the United States. Liberia was founded in the early 1800s by free men and women of color from the United States, African Americans, if you will call them now. And they were returned to Africa following, the end of slavery here in the United States to found a country where, the black people will live in dignity. Mm-hmm. And this is how Liberia was founded. The country's first, among the number of presidents we've had, 24 presidents, 10 of those were actually American-born. Wow. As a matter of fact, the first president of the Republic of Liberia, Joseph Jenkins Rabos, was born in Norfolk, Virginia in 1807. He was the first president. He led the charge for the Liberia's Declaration of Independence as the first black country in the independent republic in Africa specifically. And it was because of Liberia that many African countries saw the need for self-emancipation. Mm-hmm. Of course, it's important to note that before Liberia, you had the Empire of Ethiopia, an ancient empire, but it was, a monarchy. And Liberia thus became the first republic in Africa in 1847.
My goodness. Yeah. So that's a very rich history of Liberia.
We have a very rich history with the United States, and importantly, the interpersonal relationship of people, common culture. You can see the top pin that I have, which is reflective of the American flag.
It does. Yeah, I looked at that and I thought, wait a minute, it almost looks like the United States flag.
That's the Liberian flag. It's called the Lone Star. And it has its own symbolism and meanings if you were to go through the various aspects of what the star is and what the colors are.
Very, very important. So let's talk about the impact, outline the crisis of Ebola, what's happened in that regards.
Well, the Ebola, the Ebola virus disease first entered into Liberia because a national of Guinea traveled across the border into Liberia seeking, he was at a funeral in Guinea and for somebody who had passed because of Ebola and had been afflicted by the disease, and he was seeking medical attention. And so he came over the border into, the borders of Liberia is, they're very porous. And people come and go, people trade back and forth. In fact, if you just go over the border from Liberia to Guinea, there are family members on both sides. And so he came over the border seeking medical attention and brought with him the Ebola virus disease into Lofa County. The country is broken up into counties. Here they're states, but in Liberia they're called counties. And so he came over into Lofa County and brought with him the disease. And since then, this happened in the spring, in March. and since then, the country has really been afflicted with this disease.
Why is Liberia dealing with the highest number of new cases and the largest number of deaths? What is making this occur?
Unfortunately, immediately after the outbreak of this pandemic in northern Liberia, the main area of early infection was Monrovia, the capital city of Liberia, a city of more than 1.5 million people. And of course, ours is a country, coming from years of devastating civil war, where the country was almost completely destroyed. So we have serious infrastructural challenges in terms of basic services. And this is why, in spite of the efforts we've been making to rebuild our health infrastructure, the entire system got overwhelmed because we just couldn't cope. Yeah, so this is how, you've had this rapid spread. And of course, a disease, that has been an anomaly. Nobody knew, there's no history. You just didn't expect it. And you don't know how to respond. And so by the time you look, this disease, which is an opportunity killer, is just upon us, and it's just wreaking havoc.
And it's really something. Vickie, when I remember when I was talking with you, you were talking about also the cultural practices in Liberia that help continue the disease, the infection. Talk a little bit about that.
Yeah, in Liberia there are cultural practices, and one of the more than cultural practices, I think a lot of Liberians were in a state of denial when this disease first showed up because of insufficient information on the disease, on the Ebola disease. The other thing is the disease mimics malaria, which is a big disease in Liberia as it is. So people were getting fevers and headaches, and it's just like malaria. So people thought it was malaria. Some people thought it was Lassa fever. Nobody really knew anything about the Ebola virus disease. And so, and the other thing is Liberians eat dried meat. And they said that the Ebola virus, the host of the Ebola virus, is the fruit bat. Well, that is like a delicacy when it comes to food in Liberia.
It's a delicacy.
Yes, people eat the fruit bat. Particularly in certain parts of Liberia, and so people were getting the disease from that, and so so it really became a problem because of the state of denial. I would say that was the main thing, because people did not believe, first of all, that there was such a disease. So when you go to Liberia now, you see all these posters, Ebola is real. There are musical artists making songs now, Ebola is real.
Is real.
Yeah, so that people really know and understand that there is such a disease, and we need to be very careful about that.
So now, you've spoke about that before then, Civil War, the country was then getting back. Now, what has been the impact of Ebola now on the Liberian people?
I mean, words are actually inadequate to express the tremendous impact of this pandemic. The potential that if nothing is done to actually contain this scourge, it could actually lead to nation collapse, as have been predicted. Yes, it has the capacity. But the thing is that the Liberian people, the government and people of Liberia, in partnership with the international community, and of course you've seen the upscale, the surge in United States intervention to bring this disease under control. We're very hopeful that the intervention measures that have been put in place now will help to curb the disease. And of course, as Vickie indicated earlier, We had a state of denial simply, in time past, simply because people didn't know. We had no reference as to the existence of this disease. And what people mostly saw were bodies being taken away and those kinds of things, and seeing people in the space, a suit-looking thing coming around. They were not used to all that.
Right.
But with the fact that so many people are dying, there's a recognition that yes, this is real. And because of the cooperation of the general public, a lot of efforts are being made now, and we will look forward to this disease being brought under control in months.
Wow.
And Ingrid, one more thing I'd like to add is, a country of 4 million plus, there's 700,000 people, Liberians, to one doctor. There's 890,000 Liberians to one dentist. So this is the situation that we're talking about, and then you get hit with Ebola, and you're losing your doctors to Ebola, and you're losing your health workers and your nurses. 86 health workers dead because of Ebola. So it really it's drained and strained an already broken health infrastructure. So that's the problem that Liberia is dealing
And I
with.
think that's what people don't know.
Yeah.
They don't realize that this is really a lot more serious than we could ever imagine. So you're dealing with, and give me that statistic again. For one
doctor, you have 700,000 Liberians. 700,000.
And then with the loss of the healthcare work, those are in the health profession.
Yeah, we've
that's
lost
huge.
some of our best doctors to Ebola. So that is the problem. So that we're dealing with, and that's how hard the country has been hit.
So now, talk about what are other countries doing, and what is the international community doing to help Liberia?
Well, at this point in time, there's tremendous international effort and focus, and it's like all hands must come on deck to deal with this crisis.
Yes.
But the predictions we keep getting, and the forecast is that we seem at this point in time to be playing catch up. But at least we started some effort. I mentioned earlier the social United States intervention.
Yes.
With the announcement by President Obama that 3,000 American troops are going to be deployed in Liberia, and just the upscale, that's 17 medical facilities with quarantine centers that are going to be constructed in various parts of the country, in addition to many other international efforts. The World Health Organization, which is the United Nations agency, many other countries with which Liberia have bilateral relationship that are friends of Liberia, they are coming in and providing assistance. Of course, in addition to friends of Liberia, people who are in the private sector, even here in the United States, private American citizens, organizations, charity groups, individuals who are contributing in various ways, like this program that you have made available to create awareness about what's happening. So it's been tremendous support, being provided Liberia at this critical time in our history in dealing with this pandemic.
Right. Yeah. And it's so important.
It is. And the United States has been an ally, with us for many, many, many years back to our origin. And so, we're so grateful to the United States for all the help that we've been getting. The CDC, the Center for Disease Control, and then there are other NGOs like the Doctors Without Borders and Red Cross. And just yesterday, I was in Charlotte, North Carolina, to send off a fully loaded cargo plane from Samaritan's Purse, which is the organization that the son of Billy Graham runs.
Oh my goodness.
Filled with PPEs, protective gear and whatnot. So we're so grateful for all the outpouring of assistance that we've been receiving, but we need more. That is the message.
And that's what's so important, because that word needs to get out about what is actually needed. Tell us about some of the needs that need to happen.
particularly the PPEs, your body suits, and because we have so many deaths, the body bags and the gloves and goggles, and even I've heard lately food, because a lot of the clinics, the ETUs, the treatment units, don't have enough food to provide the patients that are coming in there. I mean, imagine we need 1,000 beds. It was said the other day we only had 240 hospital beds, the medical tents. They're turning away people with Ebola because there's no room for them, there's no beds. So these are just some of the material resources that we need. And of course, once we collect all these things, how do we get it into Liberia?
Yes.
So, it has to be airlifted. If we send it on the ship, it's 41 days, may not get there on time. So then we need cash donations to help us. SN Brussels was able to help us the other day airlift some things into Liberia, other organizations like Direct Relief also sent a plane into Liberia. So if we can get, cash donated, then we can also ask some of the aircrafts that are going into Liberia or into Ghana, and then we can ask the UN to airlift it into Liberia.
Oh my good. So it's like a cooperative
Yeah.
effort
Yeah.
about that.
Yeah.
So if you have people, our idea is that, we're on Fairfax Public Access, we're going to get this out. How should they get involved? What's the best way to get involved?
The best way to get involved is to, first and foremost, the Embassy of Liberia represents the government and people here in the United States. Individuals and groups interested may contact the embassy.
Excellent.
And we will provide the necessary contact information to you. Better still, there are humanitarian organizations, charity organizations, American organizations that are involved in the fight, so people can contact them. Vickie mentioned Samaritan's Purse. This other group called SIM, which is also in the front line working to contain this epidemic. We have a global health ministries, another charity organization based in Minnesota that have been working for decades in Liberia doing charity work, and they are in partnership with the embassy in terms of the collecting and shipping of materials to Liberia. And so there are many, many other channels, and so once people are interested and they want to get in touch with the embassy, they may do so.
Excellent, excellent. There are many Liberians who live here in the United States. Talk about some of the things that they're doing too.
Liberians have really been mobilizing and really supporting the effort. They're collecting some of these PPEs and they're bringing them into the embassy. We have a warehouse in the at the Port of Baltimore where we're collecting boxes and hand sanitizers, and they've really been bringing those boxes in. So we're just saying if you want to help the Ebola effort, just try to find any sorts of material resources like gloves, chlorine, so that people can chlorinate their water to wash their hands. The Chicago Liberian Association called the other day and they have filled 10 40-foot containers of PPEs,
goodness.
and they're looking to get it into Liberia. So these are some of the things that Liberians are actively doing in their communities to help the effort.
And I like how you said it's Liberians.
These are Liberians.
So I take that there is a role for all of us to play. And to be able to solve this, we're all going to have to get on board about it.
Yes.
And my goodness. Any other final thoughts? Do you see glimmers of hope anywhere?
Yeah. There's going to be an end to Ebola. This will not stay around forever. And so Liberians want to look beyond Ebola.
Yes.
We want to look. This was a country that was one of the fastest growing economies in the world, coming out of the ashes of war. you already know maybe about Liberia's rubber, iron ore, and now oil. So we are looking forward to that. We want investors to come in and invest, start companies, and we're looking to a brighter future for Liberia once this Ebola is done and over with, and we intend to kick it out of Liberia.
Exactly. And with the world's help, we can do that. And I'm hoping that all those watching this show are really saying, I need to get involved. Here's my opportunity to make a difference.
Yes, and I just wanted to add to what Vickie said.
Please.
It is not a situation where every now and then Africans are out there begging for help. Ours is a tremendously rich country. We've been having challenges over the years, and we have, since the end of our civil crisis, 11 years ago, been trying to reform. As Vickie said, Liberia was one of the fastest growing economies in Africa. And, for the past 10 years, we have attracted over $17 billion in direct foreign investment in Liberia. And, I just, read how, for example, ExxonMobil and Chevron, all of these companies, they are in Liberia in the oil business right now. And what I was just saying is that ExxonMobil, they have just announced how this Ebola thing is affecting their operation. Here is a country coming from war, brimming with enormous possibilities. Unique country. Liberia has 43% of the remaining rainforest in the West African sub-region. With unique plant and animal species. You talk about the pygmy hippopotamus that is unique in many parts of the world. It's in Liberia. In addition to some of the remaining species of leopards, chimpanzees, and all those kinds of, and you talk about coastlines. Some of the best surfing places in the world have been identified in Liberia. White sandy beaches. Our challenge is development, the infrastructure. We want our American friends, our American partners, our American brothers and sisters to be involved with us. Take, for example, Bob Johnson, the African-American billionaire. At the end of Liberia's Civil War, he built a beautiful resort that is, a pride, not just in Liberia, but in Africa, right in Liberia. So there is so much hope, and the country was rebuilding. And we stand at risk of losing the gains that we have made over the past 10 years of national reconstruction because of this pandemic. But we are determined. Liberians are a resilient people. This disease is not going to keep us down. Just as we survived during the war, we shall survive. And Liberia, Africa will be the final frontier, the frontier for economic progress in the world. Yes.
I just love what you're saying, because it's the final frontier. Is that the whole idea, and with the help, this will just be a crisis that we'll look back in the past and say, this is how the world responded to a need.
Yes.
And hopefully that will be the takeaway. When they see this show, they'll say, well, I need to really get involved here because this is important. In terms of trying to get some final thoughts, because we have a few minutes left. And give me some final thoughts about it. You spoke about the beautiful the land, the different species that are there. It's a beautiful place actually I dream of visiting. But give us some final thoughts.
My final thought is, for Americans, we're very delighted, we're grateful for the opportunities. And the extent to which the Ebola crisis has been developing and how it has linked the United States and America reflect how much the common bond that binds us. Imagine a number of Americans doing charity work. In the front line, you heard about the American doctors and nurses that were brought over because they were infected. That showed the common bonds. And our people are interlinked because of the common, our culture and people, families, and everything else. We would like for the United States and the American people to stay the course with us to ensure that our reconstruction process is sustained. In doing that, America stands to benefit enormously. in terms of the business possibilities, the economic possibilities, that we can, through the United States, we can build our human and infrastructural capacities. And in the process, the United States can have a place to do business. And it's a win-win situation.
It's a win-win situation. And I think that that's what it really needs to happen, because the beautiful history of Liberia and the fact of us working together, this brings our partnership and binds it even closer together.
Yeah.
Well, I'd like to thank both of you for being here on the show. I mean, you've really painted a very good picture about what is happening there in Liberia, and also bring to us also the beauty of Liberia and why it's even more important that we all, as you say, all hands on board. No doubt about that. Thank you.
Thank
Vickie
you,
Moore. It was
Ingrid,
great
for
to have
having
you.
us here.
And Gabriel Williams, pleasure having you here too.
Thank you so much for having us.
I know we can stop Ebola with everyone's help. So my final thought is from Nelson Mandela. It always seems impossible until it's done. Thank you for watching Ingrid's World. And don't forget to become a fan on Facebook for instant Ingrid World news, or see ingridsworld.org. Thank you for watching.